One common question that we often get is how do we know that this trial is right for me?
So that's a great question. And we always want to enroll the proper patients in a trial if we believe that they might be helped by being in the trial. And while we can never guarantee that somebody is going to have a good outcome by being in a randomized trial, in general, people have done better in randomized trials than not in randomized trials. And we really think it's because the physicians that are taking care of you pay a lot of attention to you, particularly when they know you're enrolled in a study. And you've got study personnel that are calling you all the time to seeing how well you are doing. It's just less likely that things may get missed. But how do we know that you're the right person for this trial? Well, this trial is meant for you. And when I say that, it means you're a woman, you are Black, and or you are of Hispanic ethnicity. And you have multivessel or left main coronary artery disease. That is extensive blockages in the arteries of the heart. And those conditions are almost always treated with either stents or with bypass surgery. But you're not a simple patient. You're a patient because of your clinical condition and because of all of those blockages put you at increased risk. So this trial is designed for you to determine which of the procedures should be done first. And let me kind of emphasize that because coronary artery disease or blockages in the arteries of the heart is a lifelong condition. And neither stents nor bypass surgery cure the underlying condition. Medications, which you will be on regardless of whether you get stents or surgery, can help slow it down. But this is a disease that tends to advance with progressive age and with genetics and with other risk factors. So what we're trying to do is to determine which procedure should be done first to help you live the longest and have the best quality of life. But importantly, these are both procedures, stents and bypass surgery, that are FDA approved, that they're non-investigational, they're done on hundreds of thousands of people every single year. And this study will go on for up to 10 years. And it's likely in 10 years, given that you do have extensive coronary artery disease, that you might have both procedures. You might have stents first and then later surgery, or you might have surgery first and then later stents. All we're trying to determine is which procedure is best for you to have first, and the other procedure is always available to you if needed and if necessary. So that's the kind of patient we're looking for. You are somebody who is trying to improve outcomes for yourself or for other people that will be like you by participating in this study. And you have extensive coronary artery disease, woman, Black, or Hispanic patient. And if you do join this study, what I can promise you is that we'll be taking very good care of you and looking after you very closely.
And let me add to that, Greg, that is wonderfully said, that this is not a short study. This is not a sprint. This is a marathon. We will follow our patient for 10 years. So the moment you sign up for this study, we start a collaboration that will be for the next 10 years. And during this collaboration, as Greg said, we will take excellent care of you. The team will be calling you very frequently, not only for study purposes, but also to check on how you are doing. And those are very well-trained physician and other personnel. So they will essentially check on your health, on your potential symptom, and eventually advise if you need to seek medical attention. And this is a really, really important and unique safety network that probably is the case why, as you said, patients in clinical trials do better than patients outside the clinical trials. And you must know for sure that we are committed to improving the outcome of women and Black and Hispanic patients. So this not only will help yourself, but is most likely to help other people like you, family members. And I think this is a great reason to consider joining this study.